All right, good evening. You're welcome to today's lecture. Today, we take a look at action and uses of medicines, and we continue from our review, NPCE review, NPCE review. So, the first question for today. The first question for today says, question one. Question one says, what does the term antibiotics mean? What does the term antibiotics mean? Option A says, non-organic or synthetic substances that selectively kill or inhibit growth of other microorganisms. Option B says, substances produced by some microorganisms and their synthetic analogues that selectively kill or inhibit the growth of other microorganisms. Option C says, substances produced by some microorganisms and their synthetic analogues that inhibit the growth of organism cells. Option D says, synthetic analogues of natural substances that kill protozoa and helminthes. All right, so the question is talking about antibiotics, the correct definition of antibiotics. So let's answer the question. Actually, the answer to this question is B. B says, substances produced by some microorganisms and their synthetic analogues that selectively kill or inhibit the growth of other microorganisms. That is the answer. Why is B the answer? That is actually the standard definition of words of antibiotics. Because actually, antibiotics are substances that are produced by microorganisms. So the microorganism in question here can be bacteria or fungi. And this, not just the substances itself, even the semi-synthetic form of that substance, or even its synthetic analog, provided that the parent substance is from microorganisms. So whether they modify some constituent, some substituent to produce semi-synthetic version, or they totally have a synthetic analogs for that particular substance is in question is produced by microorganism. Yes, it is an antibiotic. So what it means is that there are antibiotics that are natural, there are antibiotics that are synthetic, there are antibiotics that are semi-synthetic. Whether it is natural, semi-synthetic, or synthetic, is an antibiotic, provided that the main substance is from the natural one, is produced by another microorganism, be it fungi or bacteria. So that's what antibiotic is all about. So then they selectively kill or inhibit selectively. That means or inhibit the growth of other microorganisms. That means it does not attack, kill the host organism, the organism that is infested. If I should use the infected, not infested, infected by that particular microbe, like human being now, I am as a human being, as a human being, I may be infected by a particular microorganism. So antibiotics will attack that microorganism without affecting me. So that's what you mean without attacking me. That's what you mean by selectively inhibiting or killing the microorganisms. So this is the main difference between antibiotic and antibacterial. For example, antibacteria is not produced by microorganism. That one is totally produced through other means apart from microorganism. So that is why it's between antibiotic and antibacterial. You know all the sorry, what am I saying? That is not all the antibacteria are antibiotic. Yes, not all the antibacteria are antibiotic, but all the antibiotic and the antibiotic and the antibacterial, but not all the antibacterial. There are some antibacterial that are not antibiotic. So that's what I'm trying to make. So antibacteria may not necessarily be from another microorganism. It may be produced it may produce through the different ways that have no business with what microorganism. So that's a topic of topic for another day. So that is why I chose B as the answer to this question. Now let's look at the other options. Let's look at the other options. Option B. Option A says what did option A say? Let's go back to option A. Option A says non-organic or synthetic substances that selectively kill or inhibit the growth of other microorganisms. Excuse me. Selectively kill or inhibit the growth of other microorganisms. I agree. They say it's selectively kill or inhibit the growth of other organisms, but there's something wrong with that option. It's wrong, something wrong with it, but the option excludes natural microbial origin. Yes, we do not say that they are from natural microbial origin. No, we just say non-organic or synthetic substances. So that's why option A is not the correct answer. The antibiotic source, I think the non-natural one must come from microorganisms. They cannot be modified, become semi-synthetic, or it will be synthetically produced. But in that one, that's standard, that's core substances must come from animal origin. She sounds like penicillin. Actually, penicillin came from where? Actually, fungi. It shock you. Penicillin came from fungi through the work of Alexander Fleming, even though it came out of serendipity, accidentally discovered the penicillin. That is a topic for another day. So penicillin is produced from other organisms, fungi, used to selectively kill or inhibit the growth of other organisms. Even though yes, we know we have penicillins that are semi-synthetic, we have penicillin that are synthetic. Let us not go deep into that. Okay, now so option okay, B, option A, I said that it removed natural microbial origin. So that was renders that option A incorrect. So and the option A specifically pinpoint antibiotics to be synthetic. They are not only synthetic, we have semi-synthetic one, and we also have natural one. So that these 2 points made option A not to be the answer. So option C says, what did option C say? Option C said, what did option C say? Sorry. It says substances produced by some other microorganism and they are synthetic analogs that inhibit the growth of organisms, organism cell. This one remove but this one mess up in two ways. First one is said that that they are what that is says that they are produced by some other microorganisms and their synthetic what analogs. Now, antibiotics do not inhibit. I think that part is okay. That first part is okay, but in this last part, antibiotic does not inhibit human or animal cells. It did not add selectively. It just said organism cells. So that's renders option C incorrect. Option C also here immediately look as if it attacks human cells or animal cells. So let us note that as the error in this option C. So you do not inhibit the growth of organism cell, that is the organism itself. So what is target is what? The microbial agent, the microorganism, not the entire organism cells, host organism cell. No. All right, so that's render option C correct. Option D. Option D says synthetic analogs of natural substances that kill protozoa or helminthes. In the first place, antibiotic had no business with protozoa and helminthes. We have other classes of drugs we call other classes called anti-protozoa and anti-helminthes. So that was rendered with option B incorrect. And option D is also trying to let us know that antibiotics is only about synthetic analogs. No, we have synthetic too. We have what? Semi-synthetic too. We also have synthetic ones. Sorry. Yeah. Okay. So that will be all for question 1. So let's go over any question. Please, if you have any question, feel free to ask. Question 2. Question 2 says, general principles of anti-infective therapy. General principles of anti-infective therapy are A. Clinical judgment of microbial factors. B. Definitive identification of a bacterial infection and the microorganism's susceptibility. C. Optimal route of administration, dosing frequency, and duration of treatment. D. All of the above. All right. What is the answer to this question? Okay. For this question, I will choose option D, all of the above. Why? These are my reasons. For effective anti-infective therapy, actually, this requires proper clinical judgment. You have to make accurate, proper clinical judgment. So you're sure if you talk about being sure of what you are treating. You know, you make proper judgment with respect to microbial factor and other factors involved. Then, effective anti-infective therapy also requires that you identify properly the organism in question. You have to identify properly the causative organism, because if you don't identify the causative organism, you're wasting your time because you're not able to treat that particular issue well, because you don't even know what you are fighting, what you are up against. And it also requires deep knowledge of drug susceptibility. Yes. How does the drug, how does the microorganism behave when they come in contact with the drug? What I mean is this: does the microorganisms, does the drug take care of the microorganism, or does the microorganism take care of the drug? You know, so the microorganism resist the drug, or does it burn out when it comes in contact with the drug? So these are things you also put into consideration. This one is simple. You can do sensitivity tests for that particular organism towards drugs, different drugs, antibiotics. At the end, you're able to get the one that actually attack the, the microorganism. Although this is done in vitro, there are the other factors so, but at least it will give us a direction about what is happening in the patient system. So it's important to have a knowledge of drug susceptibility. Then the next requirement is that is correct dose, correct dose, correct route of administration, frequency of therapy, and the duration of what the treatment. These things are very what you require, what is required for effective anti-infective therapy. And this is exactly what all the options in question 2 talk about. So that's why I chose the option D to be the most correct answer. So all the option A from option A, B, C individually is not the answer because none of them is what complete. All right. Let me look at question 3. Question 3 says, sorry, minimal duration of antibacterial treatments usually is A, not less than 1 day, B, not less than 5 days, C, not less than 10 to 14 days, D, not less than 3 weeks. The minimal duration of antibacterial treatments. From the look of options, I will choose option D. Sorry, option B, not less than 5 days. Why? Why I choose this is because most of the bacterial infections last at least 5 days before they are eradicated. At least 5 days, most of the bacteria of infection. And also why I choose this is because if you have a shorter course of the treatment has been proven to lead to treatment failure and the resistance of the what microorganism. So that's why I not choose. But that's why I choose option B, because it should not be less than 5 days to avoid microbial resistance and the treatment failure. Option A is incorrect. Why is option A is correct? Because option A just said not less than 1 day. In fact, 1 day is not enough to eliminate bacteria. So it's insufficient to be able to do what eliminate or eradicate one bacteria. That's why I will not choose option A. Option C is also incorrect. Why is it incorrect? Because it just said 10 to 14 days. Now, it's not a general thing, 10 to 14 days. You This one now applies only for specific infection. Apart from not being a general thing, uh, there are some of the microorganisms that are very stubborn, like uh, like Mycobacterium tuberculosis and other, even Staphylococcus. All those ones are very, very stubborn. So, I mean, Staphylococcus aureus, all these ones are very stubborn. So, treatment of them at least should not be less than 10 to 14 days. Should not be less than this one because of the nature of what you are treating. So, the option D, C apply to specific infections. That's what I'm trying to do. What to make so option C is not the answer. Option D says 3 weeks. 3 weeks is excessive. It's excessive for routine infection. It's Essex for routine what? Infections. Okay. Number 4. Question number 4 says rational antimicrobial combination is used to A. Provide synergism when microorganisms are not effectively eradicated with a single agent alone. B. Is used to provide broad coverage. C. To prevent the emergence of resistance. Option D. All of the above. I still choose option D. All of the above. Because all these one packet that are in that are from option A to option B, all of them are like in what? Rational antimicrobial combination. They are the importance or the use of the good advantage of what rational antibacterial combination or the result of rational antibacterial combination. So let me throw more light on that. Now, this combination therapy is actually used to achieve synergism. What is synergism? This one makes it strong, this one makes it strong. They work together to attack the microorganism. You possibly say at different spots, just like combining antibiotic. We want to attack the cell wall, we want to attack nucleic acid or protein synthesis in the body. How the effect will be what they can work. These two will work synergistically to take care of what the microorganism. So combination, rational combination actually leads to what help to achieve what synergism. Now, number two drugs are involved. One and the group of is that two of them will have different spectrum of what activity. In fact, one may be one may be more would attack more of what gram positive microorganism, while one may be better active with gram negative microorganism more. So if you not combine these two drugs, which one has more effect on gram positive and the second one has more effect on gram negative. When they come together, you see that the spectrum of activity is well covered, both um from the from the both from the what is it called from the gram positive side to the gram negative side. So the renal antimicrobial combination actually provides broad spectrum coverage. Now, the next one, remember telling you the reason why I chose option D. The next option, option C, says it has to prevent emergence of resistance. Of course, when you have two powerful anti 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 antibacterial or antibiotic, as the case may be, this one is attacking at this end, this one is attacking at this end, and when they are combined, you will see that they will pull their activity actions together to prevent what emergence of what resistance. Even if even if one may may not be too strong, but because they are together, combined together, they help to fight the microorganism. In fact, the microorganism, no matter what is trying to change some certain things in the drug to be able to be resistant, it will not work because one is attacking, one is attacking. So that's why I chose option D as my option. But option A to option C, they are correct too, but they're not complete. They're not complete with respect to they're not complete with respect to the nature of the questions. They're not what complete, they're just parts of option D. So that's why I couldn't choose any of them and choose all D. I think good. So let's look at option question 5. Look at question 5. Question 5 says mechanisms of bacterial resistance. Mechanisms of bacterial resistance include all except A, active transport out of a microorganism, or and hydrolysis of an agent via enzymes produced by a microorganism. Active transport out of a microorganism and or hydrolysis of an agent via enzymes produced by a microorganism. B. Enlarged uptake of the drug by a microorganism. C. Modification of a drug target. D. Reduced uptake by a microorganism. I will choose B. Why B? I will choose B. So let's see why I choose B. This is enlarged uptake of drug by a microorganism. Remember, you said the question said mechanism of bacterial resistance include or except. Basically, if there's enlarged uptake of drug by a microorganism, that means there will be enough of the drug in the microorganism to tackle the microorganism. So this is not the answer. Because you know the mechanism of what resistance. So it is not the answer. Because once it enters the system, the organism system, it will actually effect a change and be able to do its work. And many of them enter, they'll be able to attack the microorganism and there will no room for what resistance. So because the question says except, so I will not choose B. So I will choose B because B is now the answer. Other ones like A is not correct. A says active transport out of a microorganism or hydrolysis of an agent via enzymes produced by what microorganism. This one is incorrect. This one is what incorrect. Remember the question says or except so or except. So this one is incorrect because it's actually a mechanism of bacterial resistance like enzymatic degradation, like beta lactamases. This is a classic resistance mechanism because it's a classic resistance mechanism. So it will not be, it make it not to be the answer because of the except in the question. Number 6, option C says, what did option C say? Option C says, modification of the drug target. Yeah, this is actually a resistance mechanism. I'm not going to look for a way to modify the drug target. So because it's how do I put it? How do I put it to so provided that the microorganisms that the microorganism modify the targets which leads to what resistance. Because of that one, I don't think there's no except. Would have taken the option as the answer, but because there's except, it renders option C not to be correct. Sorry, seems I am a bit feeling sleepy. That's why sometimes what I'm saying, I'll be saying some incoherent things. Please pardon me. After this question 5, we dismiss for the day. Please pardon me. All right, so the answer is what? Sorry, the option A. Sorry, option C is not the answer because actually target modification is actually the resistance mechanism. But the question says which of them is not. Okay. Option D says, so option C is incorrect. Option D says reduce uptake. Option D says reduce uptake by microorganisms. So if there's a reduction in the uptake of by microorganisms, there will be not much in the system to be able to take care of the water. To be able to take a bullet or to place with you smoothies. Okay, let's conclude, please. I say, let me look at something. This one is sleeping. Okay. Okay, so the last option say reduce uptake by microorganisms. So if the uptake of the drug, if the drug available or there to attack the microorganism is small, there's no much uptake by the microorganism. There will not much of this drug to attack this microorganism. So because of that they have the resistance because the microorganism will overpower or overwhelm the little one available. This will lead to what? Resistance. This will lead to what? Resistance. So this is a resistance mechanism. That's why it's not the answer because the question says except. All right. Thank you very much. Please will stop here. Please will stop here. Continue from where we stop in our next class. So if you have any question, please feel free to ask. Feel free to ask. Please, if you want to join our tutorials, we have 4 categories of tutorials. Just send a clear message to +234 7012 94581 070 1920945391. So with this, you'll be able to join our class and other. You choose the class of their choice and they quickly what join us and God bless you. So please like this video, but don't mind where I was sleeping and having incoherent speech. Just like, comment, save it at your favorite, and share with your friends. And God will bless you as you do so. See you in the next class.